here. I've heard about this this flattening of the curve. Can you explain to our audience what is the curve all about and why do we want to flatten it?
Yes, certainly. So this is one of the examples where the public health jargon, epidemiological jargon, made it into mainstream. By referring to a curve, we're talking about an epi curve. So basically, it's a graphic representation of how many new cases we have within during time. And when you think about influenza, for example, we see that we don't have that many cases throughout the year, and then we have that cold and flu season around Christmas, end of the year, where we see that spike in cases. That's the spike in the curve. So the curve is almost non-existent throughout the year and then spikes up during the end of the year period. So what we're having here, we're having a novel pathogen and a COVID-19, something that's newly introduced into the human population. And we see growing count of cases in a lot of jurisdictions, a lot of countries. When we see that growth in cases going really, really quickly, really high, we know that that spike of people with symptoms, there's so many of them, and it's likely to overwhelm healthcare resources. We know that with influenza, we have about 10% of the population getting influenza a year, and we know how hectic it is in that flu season over the short period of the time, during the short period of time. So with COVID-19, we're trying to prevent that similar spike, and we know that maybe more than 10%. We want to prevent that. We want to expand it, spread it throughout the longer period of time, so that any point we are not above that capacity level for the healthcare system. So this virus causes symptoms more in the lower respiratory tract. So that's why we see the cough. That's why we see fever, and we also can see that the impact on lower respiratory tract on the lungs can lead to a pneumonia, to more severe presentation. But people can have a wide range of symptoms. The most common, as I mentioned, are cough, fever, worsening shortness of breath. But you could also have sore throat. You could have runny nose. Not as likely, not as frequently, but it's also possible. This is a respiratory pathogen, so it's similar to flu, cold viruses. It spreads via droplets and contact. So this is basically links to the whole notion of social distances. We know that if someone is talking, speaking, they might be basically producing these droplets, large particles that can fly up to 2 meters, and then they fall down onto surfaces. So if we're keeping a distance over 2 meters, a meter and a half, so on, we are very significantly reducing the risk of getting in contact with any of those particles. And we are also wanting to make sure that frequently touched surfaces are clean, disinfected on a regular basis, so we don't get this by touching with our hands and then let's say touching our face. There's also one important measure from infection prevention and control is recommending that people who may have experienced symptoms of coughing, sneezing, they do so in their elbow, not producing and expectorating these droplets into the air. But we know even with that, they will still only travel up to 2 meters. It is not a virus that you can get from breathing the air in the same room that the other person infected been before. That's an important message here. So we are following the recommendations of the federal government, and we are recommending that individuals who return from international locations back to Canada, they do self-isolate for a period of 14 days and monitor their symptoms. If they develop any symptoms, again, depending on the symptoms are, they can either try the self-assessment tools online that are available, or they can call public health. What we recommend for people not to do is not to go to the emergency departments, not to go to the family medicine offices for mild symptoms, because again, if they are if these symptoms are due to COVID-19, we want to protect others and prevent the spread of the pathogen to others.